Guys, welcome to our today's session. Uh, in our today's session, we shall talk about one of the most commonly used analgesic known as paracetamol. So, in this session, we shall look at some of the brands of paracetamol. We shall look at some of the dosage forms of paracetamol. We shall also look at the mode of action of paracetamol, okay, and even indications of paracetamol. Then, lastly, we shall talk about the side effects of paracetamol. Paracetamol is an analgesic and antidiuretic drug under class known as miscellaneous analgesics. Now, miscellaneous analgesics are a class of medications that does not fall under non-steroid anti-inflammatory drugs, or they do not fall under class known as opioids. Paracetamol is used temporarily to relieve mild to moderate pain and fever. It is commonly used as analgesic in cold and flu medications such as Panadol cold and flu. Paracetamol is also combined with other pain relievers to achieve synergistic effect. The onset of action for oral forms of paracetamol, that is tablets or capsules, is 30 to 60 minutes after taking it, while the onset of action for injectable forms is 15 to 30 minutes. While the onset of action for rectal form is still unknown. This is to say that the time taken for paracetamol to start acting in the body when taken orally is 30 to 60 minutes, but takes 15 to 30 minutes when given as an injection or infusion. Now, the paracetamol comes in different brands. There are numerous brands of paracetamol in the world. Now, some of the most common brands of paracetamol are Panadol, we have Calpol, Medimol, Paralgan, Alvedon, Adol, Panamox, Paracetamol, we have Timedol, Andimol, and many more that you have come across. Dosage form. Paracetamol come in different dosage form. They come in oral tablets. I think you have come across oral tablets. We also have extended release tablets. Then we have modified release tablets. We have orally disintegrating tablets. Then we have effervescent tablets. We have oral capsules. We have oral powder. We have oral suspension, intravenous infusion or injection. We also have suppositories. You can see some of them in our. How does how does how do paracetamol work? Now, paracetamol work by blocking chemical messengers in the brain that let us to know when we are in pain, and by affecting the chemical messengers that regulate our body temperature. Paracetamol inhibits the production of prostaglandins, which are made by the body to deal with illness and injury. It also acts on the serotonergic opioids, nitric oxide, and even cannabinoid pathways. Now, indications. These are some of the users of paracetamol. There are very many users of paracetamol. One of them is rheumatic and muscle pain. We have mild arthritis. We have toothache. We can also use it for period pain. We can use paracetamol for cold and flu symptoms. We can use it for sore throat, okay, sinus pain, post-operative pain. Then we can use paracetamol for pyrexia, normal headache, and even tensional headache. We can also use it for migraine pain and even back pain. These are some of the dosage of paracetamol. Okay. For instance, paracetamol 500 milligram tablet ama capsule, adult and children 10 years of age and older. So when you have someone of 10 to 15 years, should take one tablet up to 4 times a day. Okay. Adult and children 16 years and above should take 1 to 2 tablets up to 4 times a day. Then we have paracetamol 120 milligram in 5 ml oral suspension, children from 3 months or 6 years. So 2 to 3 months old children should take 2.5 milliliter up to 2 doses in 24 hours. Okay. Then we have children who are 3 to 6 months old. They should take 2.5 milliliter up to 4 times a day in 24 hours. And then we have 6 to 24 months children should take 5 milliliter up to 4 times a day. Then we have 2 to 4 years should take 7.5 milliliter up to 4 times a day. Then 4 to 6 years old children should take 10 mils up to 4 times a day. This table is very important when giving our children the medication. We have paracetamol 250 mg in 500 ml oral suspension, adult and children 6 years of age. So 6 to 8 years should take 5 milliliter up to 4 times a day. Okay. Then we have 8 to 10 children, 10 years old children should take 7.5 milliliter up to 4 times a day. Then we have 10 to 12 years old children should take 10 milliliter up to 4 times a day. Then we have 12 16-year-old children should take 10 to 15 milliliter up to 4 times a day. Then adult and children over 16 should take 10 to 20 milliliter up to 4 times a day. Then there's paracetamol suppositories, children from 3 months to 12 years. So infant under 12 years should have 160 milligram of suppository once a day. Very important. Huh? Then we have 3 months to 1 year old children should take 1 to 2 60 milligrams of suppository up to 4 times a day. Then we have 1 to 5 years should take 1 to 2 120 milligrams suppository up to 4 times a day. Then we have 6 to 12 years who can have 1 to 2 to 50 milligram of suppository up to 4 times a day. Now there are paracetamol just like any other medication. Paracetamol also has different types of side effects. So side effects of paracetamol can be classified into serious side effects and common side effects. Some of the serious side effects of paracetamol are allergic reactions which may be severe and include skin rashes, itching, or hives. Okay, they can also include swelling of the throat, tongue, or face, shortness of breath, or wheezing. Another serious side effect of paracetamol is skin rash, or peeling, or mouth ulcer. I mean, sorry. Breathing problem may most likely if you have experienced them before when taking other painkillers such as ibuprofen and aspirin. We may also have unexplained bruising or bleeding or becoming unusually tired. Okay. We can another serious effect of paracetamol is liver problem that might be accompanied by nausea, sudden weight loss, loss of appetite, and yellowing of the eye and skin can also occur. Okay. The most common side effect of paracetamol is redness or soreness in or around the rectum. Yeah, to conclude, just like any other drug, we have said, uh, stop misappropriate use of paracetamol. Okay, in case the side effect persists, kindly stop the medication and seek the help of a doctor. Okay, everyday long-term use of paracetamol can cause liver or kidney damage. So take this medication in usual way for a short period of time